Assalamu alaikum friends, I am Malaika Sabir from BS Honors Biochemistry 2nd semester morning. Today the topic me and my group mates are going to present is obesity. As my group mates had told you earlier about obesity, now I am going to relate obesity with the topic mental health and sexual dysfunction. So move towards the topic. Obesity is when a person is carrying too much body fat for their height and sex. Obesity is the fastest growing and most challenging public health problem. In 2014, it was estimated to affect 1.9 billion adults globally. It led to serious diseases that will be explained later. Every year, its rate is increasing. Sexual dysfunction is linked with several psychological problems. Numerous studies have shown a relationship between sexual dysfunction and common mental health disorder. Body mass index BMI. In normal human being, body mass index is between 25 to 29.9, and in obesity and the person having obesity, the body mass index is more than 30.
Now I will come to the topic about the sexual dysfunction in males. As sexual dysfunction is defined by the disorder of desire, arousal, orgasm, and pain. So sexual dysfunction in males can affect men of all ages, but the most men that are affected are that who are older in age. And the most common problems they have is ejaculation disorder, erectile dysfunction, and inhibited sexual desire. Here are some points. Sexual desire dysfunction, that is diminished sexual interest or desire. Persistent sexual arousal dysfunction, genital arousal in the absence of sexual desire, that is spontaneous, intrusive, and unwanted, and it leads to that sexual dysfunction. Orgasm dysfunction, that lag, delay, or significantly diminished intensity of orgasm sensation. Erectile dysfunction in men. This was defined as the inability to attain and or maintain penile erection sufficient for sexual activity. Early ejaculation in men. Ejaculation before or shortly after sexual stimulation which was earlier than desired. Delayed ejaculation in men. Undesirable delay in attaining orgasm during sexual activity. And ejaculation in man, the absence of ejaculation during orgasm evoked by sexual stimulation, and it may affect their marriage life if remain untreated. Now here are some physical causes of erectile dysfunction. Clogged blood vessels, high cholesterol, and high BP, that is blood pressure, metabolic syndrome, condition involving high blood pressure, high insulin level, body fat around the waist, and high cholesterol, which leads in erectile dysfunction. Now come towards sexual dysfunction in women. Menopause is the time of hormonal change in women that I hope you all know about the menopause, when the menstrual cycle is stopped in women, and it is mostly after age 50. It can, as you know, that female sex hormone is estrogen, and in male it was testosterone. If there is a decrease in estrogen level, there will be decrease in sexual dysfunction. Menopause reduction in the estrogen level. When its level increase, a woman may be unable to do sex. Vaginal dryness and atrophy leads to this. When the time of menopause came, there is reduction in estrogen level and vaginal dryness, atrophy that may lead to dyspareunia. Moreover, changes to the size of the clitoris and the tissues lining the vagina. Studies have shown most sexually active women were under age 65. Now here are more detailed points. Sexual arousal disorder in women. This was defined by the presence of genital sexual arousal dysfunction, subjective sexual arousal dysfunction or both. Genital sexual arousal dysfunction was defined as the absent or impaired genital arousal, and subjective sexual arousal dysfunction was defined as absent or diminished feeling of sexual arousal or pleasure. Vaginism in women, persistent or recurrent difficulty with allowing vaginal penetration despite the desire to do so. The next point is prevalence of sexual dysfunction. Using the above common definitions, the committee reviewed evidence-based report to determine global prevalence rates of sexual dysfunction. And the results were similar to findings by the World Health Organization (WHO). Prevalence of low sexual desire was 17% to 55%, increasing with age. Prevalence of arousal and lubrication disorder was 8 to 15% in non-sexually active, while this increased to 21 to 28% in sexually active. Prevalence of orgasm dysfunction varied with location. Western societies had a rate of 25% among 18 to 74 years old women, although an approximate worldwide prevalence rate of dyspareunia was not determined. A prevalence of between 18% and 20% was found in British and Australian studies. Research in men primarily focused upon erectile dysfunction. However, the committee critically assessed epidemiological studies. The prevalence of erectile dysfunction in men under 40 years was 1% to 9%. In men between 40 and 59 years, erectile dysfunction ranged from 2% to 9% and from 20% to 30%. For men between 60 and 69 years, the range was 20% to 40%, and in men aged in 70s and 80s, the range was 50% to 75%. The prevalence of early ejaculation globally ranged from 9% to 31%. World Health Organization in 2004 were approximately 40 to 45% of women and 20 to 30% in men that had at least one person who was affected. Next point is psychological conditions associated with obesity. Its relationship between obesity and common mental health disorders such as depression, anxiety, and low self-esteem is well known. Now I will explain depression, anxiety, stress, and obesity. Among young men, mental health disorders were present for those with a lower or higher normal level of BMI, body mass index, whereas a positive correlation between mental health disorder and BMI was observed in young women. This relationship diminished with age for both sexes. And it is noted, however, that common mental health disorders such as depression and anxiety were combined as a single outcome in the study. Relationship between body mass index and specific common mental health disorder was spotted in a study with adolescents. Anxiety and depression data were collected every 4 years along with BMI, demographics, parents, education, and state of pubertal development. Its rate is increasing everywhere and every year. Mental health and sexual function. Due to the interrelated nature of body weight, mental health, and sexual functioning, possible association between all of these factors warrant further discussion, strain all. Existing evidence clarifying the sex difference in the relationship between weight loss, mental health, and sexual function. Weight loss may improve erection functioning either by increasing testosterone, reducing inflammation, or by improving self esteem and mood. Depressive symptoms and sexual functioning in female patients with obesity. Significant reduction in BMI in all patients were reported and was associated with a reduction in depression as well as improved sexual functioning. Strong association between weight loss, mental health, and sexual function cannot be confirmed based on the current evidence. Therefore, further research is needed to develop a range of treatment options for overweight and individuals with obesity experiencing sexual dysfunction.
Thank you guys for watching our video. I hope you get the main concept of this topic. Allah Hafiz, take care.